By the time your dog turns 2 years old, there's an 80% chance something is already wrong inside its mouth. For cats, that number sits around 70%. This isn't a rare condition or a bad luck diagnosis. It's the single most common health problem veterinarians see in small animals. Not a cold, not an upset stomach. A painful, silent disease happening behind those teeth right now, and most owners have absolutely no idea it's even there because nothing about their pet's behavior gives it away. Here's exactly how it starts. Every single time your pet eats, a thin, invisible film of bacteria begins forming on their teeth within hours. That's plaque, and on its own, it's still removable. But if it isn't cleaned off, minerals in saliva harden that film into a rough, cement-like layer called tartar in as little as 3 to 5 days. And once tartar sets in, it clings to the tooth surface so tightly that brushing alone can no longer touch it. Only a professional cleaning can. Left in place, tartar keeps building and eventually pushes down under the gum line, irritating the soft tissue hidden there. That's gingivitis. The gums turn red, swollen, and start bleeding easily, even from something as gentle as chewing a toy. Ignore that stage 2, and it quietly progresses into full periodontal disease. The bone and the ligament fibers actually holding each tooth in its socket begin breaking down, and unlike gingivitis, that damage does not grow back. The scariest part of all of this is how well pets hide it. Dogs and cats are instinctively wired to mask pain. In the wild, any visible sign of weakness makes you a target. That survival instinct hasn't gone anywhere just because they sleep on your couch now. So they keep eating, keep playing, keep greeting you at the door with a wagging tail, all while a genuinely painful bacterial infection quietly spreads deeper inside their mouth, completely undetected. And here's what makes this more than just a mouth problem: it doesn't stay contained. Every time your pet chews, bacteria from those infected gums can slip directly into the bloodstream through tiny breaks in the inflamed tissue. Veterinary research has linked that chronic bacterial load to measurable stress on kidney function over time, and separate studies have connected long-term periodontal disease to heart valve issues and liver strain as well. A dental problem left untreated can quietly become a whole body problem. So, what should you actually be looking for at home? Bad breath that's noticeably worse than normal dog breath. Visible yellow or brown buildup sitting right along the gum line. Gums that look red, puffy, or bleed when touched. Dropping food mid-chew, or favoring one side of the mouth entirely. Pawing repeatedly at the face or mouth. On their own, any one of these might seem minor. Together, they're your pet quietly asking for help. Small breed dogs genuinely have it worse than most. Their jaws simply didn't evolve to be this compact, which means their adult teeth are often too large for the available space, crowded together with barely any gap between them. Those tight spaces trap plaque faster than it can ever be cleaned out naturally. That's exactly why Chihuahuas, Yorkies, Dachshunds, and other small breeds make up such a disproportionate share of the patients sitting in a veterinary dental chair every single week. Cats deal with a completely different problem of their own: tooth resorption. Instead of building up plaque on the outside, the tooth itself actually starts dissolving from the inside out, and it frequently happens below the gum line, where you would never spot it just by looking. It's considered one of the most painful conditions in feline medicine, largely because cats show almost no outward signs. The only reliable way to catch it early is a proper hands-on veterinary exam, sometimes combined with dental x-rays. Prevention step 1, and by far the single most effective one available: daily brushing. A soft-bristled pet toothbrush, a pet-safe enzymatic toothpaste, and small circular motions traced right along the gum line where plaque actually forms. Done properly, the whole routine takes under 2 minutes. It sounds almost too simple, but done consistently, day after day, it is genuinely the closest thing veterinary dentistry has to a guarantee against this entire disease process starting in the first place. Prevention step 2, dental chews and toys specifically engineered for mechanical cleaning. As your pet chews and gnaws, the textured, ridged surface physically scrapes plaque off the tooth before it ever gets the chance to harden into tartar. Not every chew on the shelf actually works, though. Look specifically for products carrying the Veterinary Oral Health Council seal of approval. That seal is currently the closest thing to an independent, science-backed stamp of approval you'll find in the pet dental aisle. Step 3. Dental-specific diets and water additives, which work quietly in the background. Some prescription and specialty kibble is shaped and textured on purpose, so it scrubs the tooth surface as your pet actually bites down, instead of just crumbling instantly like regular kibble does. Water additives take a different approach entirely. A small measured amount added to the bowl that steadily reduces bacterial buildup every single time your pet takes a drink, with essentially zero extra effort required from you. Step 4, and the one nothing else on this list can fully replace. Professional cleanings performed under anesthesia. That anesthesia isn't overkill or an unnecessary upsell. It's genuinely the only safe way to clean thoroughly below the gum line, take proper dental x-rays of the tooth roots, and treat anything found along the way, all without hurting an animal that would never sit still and open wide for a stranger with sharp metal tools while fully awake. Ignore every step of this long enough, and the consequences don't stay small, they compound. Teeth loosen in their sockets and eventually fall out entirely. Infections can spread directly into the jawbone itself, weakening the structure enough that it actually fractures in severe advanced cases. What started as an invisible, painless film of plaque can end in chronic, serious, ongoing pain. Pain that, at almost every single stage along the way, was completely preventable with basic routine care. And here's the part that should really motivate you if nothing else does. A toothbrush and a tube of pet toothpaste cost a few dollars total. A single professional dental cleaning under anesthesia runs several $100s. Treating an advanced infection, performing extractions, or repairing a fractured jaw can climb into the thousands very quickly. Prevention here isn't just the healthier option for your pet. It is, by a wide and very measurable margin, the dramatically cheaper one too. 2 minutes of brushing a day, vet-approved dental chews, regular checkups where a professional actually looks inside the mouth. That's genuinely all it takes to keep your dog or cat out of that 80% statistic we started with. None of it requires special training or expensive equipment, just a little consistency. Start tonight, even if it's imperfect at first. Your pet's mouth, and eventually their entire body, will quietly thank you for it for years to come.